CBC Health Unit's second opinion and a debate over how much your doctor is willing to deal with in one visit. Some doctors' offices in Canada put a cap on the number of health issues that can be addressed per visit to one. The one issue per visit policy has been around for a long time, and more than 70% of Canadian physicians bill the government per appointment rather than draw a salary. Joining me now to discuss limiting patients' issues per visit are two family physicians, Dr. Iris Gorfinkel here in Toronto and Dr. Kevin Martin in Nanaimo, BC. Welcome to both of you.
Thank you, Carol.
Dr. Gorfinkel, let me begin with you. So let me read what this is what started the debate, is when Christina Gilman took her teenage son to a doctor's appointment last week. And this message came up she hadn't seen before. For your safety and ours, please limit the discussion with your provider to one issue per visit. And then it went on to encourage patients to book a follow-up appointment. What do you think of that?
The irony is, how does that translate into safety for patients and safety for the doctor? Like, the whole visit is about the patient's well-being. So a patient cannot understand necessarily what to prioritize. If I've got a wart on my toe that's getting bigger and it suddenly grew, and I've got that lingering chest pain that's just low grade associated with exercise, how do I necessarily know that that growing wart shouldn't be the priority?
Right. Okay. Well, Dr. Martin, what do you think?
I actually agree, Carol, with what Dr. Gorfinkel has to say there. And I wanted to thank Christina Gilman for posting that photo, which has sparked a really great conversation around primary care and how we can make it accessible and a quality experience for patients as well as their providers. And I agree. I think that a one visit, one issue policy is risky for patient care. It risks the quality of the experience for the patient. It puts it downloads a lot of responsibility on them to triage their own concerns list. So I'm not in favor personally of a one visit, one item policy, but I do think there is an opportunity for us as family physicians to help patients collaboratively to triage their concerns list so that we're dealing with the most pertinent clinical issues first, to make sure that we're dealing with them in a timeliness fashion and in a way that allows them to have the best quality primary care. Okay, so
all right, so how would that work? Give me an example.
Well, so in my situation, I'm a full-service family physician. I have a variety of different appointment length times, and I encourage people to bring a list in. Please bring a list if it's 2 items or 10 items, bring it in. But let's sit together and let me use my experience of 11 years as a family physician in my training of almost the same amount of time. And let's put that together with your concerns as a patient, and let's triage that list and see which items on there are kind of have a more immediacy in terms of my concern, and let's deal with those first, so we're not leaving critical issues to the end and then trying to rush through those.
All right. Dr. Gorfinkel, do you agree with that?
In part. I think the idea of asking a patient to triage their problems or make a problem list is not an unreasonable one. But I want to point out probably the single most factor that is important is the ongoing relationship with the doctor. So I've been in practice a little longer, closer to 27 years in general practice. And I have to say, one of the biggest advantages I have is knowing that patient. Being able to look at them and understand in a few words, is what they're experiencing really significant in their lives or not? So knowing them is a huge thing. The other part of it is trying to understand when they do bring in a list, and the list is really long, is that really the problem that they're there for? Mental health weighs very heavily, so when patients bring in super long lists, a lot of the backbone of that may be a mental health issue.
Dr. Martin?
Again, I agree with that. We're seeing an epidemic of mental health concerns. We're also seeing a lot of social issues being brought into our offices. And I agree with what Dr. Gorfinkel says, and I greatly value the longitudinal relationship I have with my patients. And it does allow me to know them very well, and it does allow me some insight into the context of how they present their concerns. So I agree with everything that's been said there. However, just last week, I had a situation with a patient that I have been their family physician for 11 years, my entire career. And there was a situation where there were 4 items on the list, and item number 4 was an MI. And even though I knew the patient very well, even though I had insight into who they were and how they presented for their care, because I didn't triage that list, the MI was left to the end. And I felt that that ate up some time that could have been better spent getting her into Emerge to have that MI treated.
Right. What is an MI, by the way?
Sorry, a heart attack.
I see. Okay.
Yeah, okay. So what's frightening about all of this, though, is the implication that one problem per visit has. And the implication is that the patient themselves will know what to prioritize. And oftentimes, that's just not true. They'll prioritize what is the loudest problem in their life at the moment. And the loudest problem, the most pain, the most impact on their immediate well-being, is not what I will perceive as being the biggest problem. So that mismatch, that inherent mismatch, is the underlying problem of asking the patient to prioritize, tell me what your biggest thing is. Most patients understand that the time is limited in a doctor's office. So a typical family doctor may take 10 minutes, 15 minutes, I take 20, but different doctors are different. But even so, to ask the patient is to dip into that patient's own medical knowledge, and that medical knowledge is very, very limited.
Yeah. So what's the answer here? Well, let me just ask, because I don't think I've really. Why? Let's begin with this question: why do certain doctors want this? What's the advantage to some doctors of a one issue per visit rule?
Well, there's no question. There's tremendous pressure on the doctor. So at any time, I look out in my waiting room, and the waiting room is generally full. So there's a lot of pressure on me. Plus the fact that I get paid depending on how many patients I'll see. I'm actually in a mixed model, but even with that, the more patients I see, the more I'm paid. So that model is inherently flawed. We want to reward doctors not just on how many patients they're seeing, but on the quality of care being delivered. The way I look at it is, if I spend the time needed to understand a problem, I'm saving downstream visits. That means if I get it right at the first time, the patient is far less likely to have to come back for a second or a third visit, or worse yet, wind up in an emergency room or with a hospitalization.
Dr. Martin, what do you think? Do you think the system is flawed?
Well, the system is flawed. We know that. In BC, we're working to try to address some of those flaws by creating alternate compensation models. But, remuneration reform which is one of the things that we need here, because the current fee-for-service model is based on the needs of a past era. Remuneration reform is a slow process, and it is a collaborative process with government. And our current PMA, or Physician Master Agreement, which is currently being discussed, does have mention of changing the way that physicians are remunerated, as Dr. Gorfinkel
towards salary or mixed models, or
I think we're creating the possibility that we can earn income in whatever hybrid we choose, whether it's salary, whether it's fee-for-service, whether it's an alternate payment plan. It doesn't really matter, as long as there are options for physicians so that we can achieve quality for patients through different remuneration models. And I just want to say, Carol, I don't know any physician who wants a one visit, one item policy. I've never met one that has. I think that we've got to ask ourselves how physicians get to that point. But I've never met a physician that has said, well, this is what I want and this is what I enjoy. I think most physicians, family physicians, the vast majority that I know, are very dedicated to providing quality care for their patients. And very few of them want to ask patients to come back for issues that need to be dealt with soon.
But having that same family physician, that longitudinal relationship, if I had to give one word of advice for patients, it's get that family doctor. Make sure you have one, because a doctor who knows you is building on the knowledge, the past medical history, the past surgical history. We know your medications. We know your habits. We know your family history. So when that knowledge is the backbone of what we're seeing in front of us, we're not wasting that 15-minute visit on asking things that are already there, documented in your chart. That's a huge advantage. And in fact, patients who have family doctors, they actually live longer. And that's also true for the same specialist. The longitudinal care, same doctor again and again, matters, and it matters a lot.
All right, we'll leave it on. Oh, go ahead. You were going to say you agree.
But with 4.5 million Canadians without a family physician, with the StatsCan, data from 2014, and we know that even by 2030 we will not achieve a decent or a healthy physician-to-population ratio. We are in a primary care crisis. I think we're in a primary care emergency. So I agree with what Dr. Gorfinkel says, that longitudinal relationship is absolutely priceless. But I'm hoping that longitudinal relationship also allows a patient to trust if their family physician says that or recommends that something can be left for a future appointment. I'm hoping that trust will allow that patient to accept that recommendation.